Hello, everybody. I'm Andrew Malley. I'm the CEO of Dignity Health Global Education, and thank you for joining us on our first DHGE Talks session. Today, I'm with a panel of the great and good from the University of Arizona. We have practitioners, CEOs, CFOs here today, and we also have an Olympic athlete and world champion joining us today as well. This DHGE first session coincides with the launch of our Mini-MBA in healthcare, which has been developed with University of Arizona and the Eller College. This program is there to help healthcare professionals succeed in business, but also at such a critical time, find ways to create a champion mindset, to be resilient, to grow, to be focused. So who better to teach you how to be a champion than champions themselves? So this program mixes the best of academia with the best of the sector and its leaders, as well as champions from sport who are given a unique insight into how to win, how to be a champion, how to succeed. And these transferable skills can be used by healthcare workers as they move through their career. So with that, I'm going to hand over to my colleague, Nick Toby from the University of Arizona. Nick, it's over to you.
Thank you, Andrew. I'm here with and represent Eller Executive Education. I am a senior director here, and my role is just to really introduce our assistant dean, Dr. Joe Carella. He'll be hosting this panel today. Dr. Carella is our assistant dean here at the University of Arizona, Eller Executive Education. He has over 20 years experience helping executives and organizations manage change and develop successful business strategies. His academic career and executive education engagements focus on corporate strategy, business performance, and decision-making. And prior to his executive academic career, Joe was a strategy consultant at British Telecom, Ernst & Young, and the 2012 Olympics. So with that, Dr. Joe Carella.
Thank you, Nick, and welcome to all of the participants. Welcome to our panel. As the Assistant Dean of Executive Education at the University of Arizona, I'm reminded of the role that medicine plays in our university. We currently have not one, but two colleges of medicine and a college of public health. Over the years, I've been surrounded by profoundly dedicated healthcare professionals whom I want to specifically thank at this time. And I am totally embracing the Thanksgiving spirit, and I want to first thank you for being with us today. I want to thank our panel for being so willing to share their perspective and experiences, and profoundly grateful to have an opportunity to work with Dignity Health Global Education and Common Spirit at the development of exciting new programs for healthcare leaders, of which this Mini-MBA is the first. In the next decade, healthcare delivery systems will transform radically. Our current capital-intensive model is under pressure as communities experience changing healthcare needs, and while at the same time as technology and automation offer alternative business and delivery models. Ultimately, the quality of leadership will really very much depend on healthcare organizations that will be able to keep populations healthy, deliver the best care possible, and do so in a way that it's at once sustainable financially and effective. Doing so requires that all of us become champions, essentially, that we develop a winning mindset. And I am grateful that I get to spend a little bit of time with our panelists today. And I'm really looking forward to what they have to say on the topic. So I'm going to, just to give you a sense of how this is going to run, I will be asking some initial questions, just general, so that we can get in the groove of things. Then I will shift to a few more specific questions, but I want to leave plenty of time for all of you that are participating in this live cast to ask your questions, to see what specific questions you may have from such a wonderful panel. So to get us started, I'm going to have the panelists introduce themselves, and I'm going to give you 15 seconds each. So I'm going to start with Debbie Himsel. Debbie, if you don't mind introducing yourself, given that you're my colleague, that's going to be super easy.
Yeah, as you see there, I'm with the faculty of Eller College of Management, and I'm in the Management and Organizations department, and my focus is on leadership development, change management. I'm an executive coach, and prior to teaching, I was actually in private industry, most notably with Pfizer, so a long background in healthcare. So thank you today.
Thank you, Debbie. And I'm going to be a gentleman, and I'm going to follow up with Ginger. Ginger, if you wouldn't mind introducing yourself.
Thank you, Joe. My name is Ginger Figg, and so the bulk of my career has been spent in large health systems and large medical groups. I retired from my position of President and Chief Administrative Officer with Norton Medical Group, which is a multi-specialty group of over 1,000 providers in Louisville, Kentucky. And in addition to leading the medical group, I had the privilege to interface with our senior team in our hospitals and with physician leadership. And the Norton hospital system, Norton Healthcare, encompasses 5 hospitals and many affiliate hospitals. So great group of people, and I was definitely privileged to be able to work there.
Thank you very much, Ginger. I'm going to shift it to John. John, if I may have you introduce yourself.
Yeah, John Godina here. I'm a 3-time Olympian. I have 2 Olympic medals, 9 total medals when you count world championships in the sport of shot put. I also competed in discus as well. Upon retirement from that sport, I actually started a company called Altus, which became the #1 private Olympic sports training company in the world. We had 21 athletes in Rio, and we got 6 medals there. Recently sold that to the employees after 10 years of working that, and now I get to do fun projects like this one.
Excellent. Thank you, John. And last but definitely not least, a very important person on this panel. I'm so excited that he could be a part of this. Doug, if you wouldn't mind introducing yourself.
Sure. Doug Watson. I'm the Chief Financial Officer with Dignity Health, based in Phoenix, Arizona. Oversee all of our operations in Arizona, which range from a very high-end tertiary quaternary hospital all the way down to small clinics that are access points across the valley. I don't have any Olympic medals, but I certainly am very proud of the work we're doing at Dignity Health.
Yeah, you're doing some phenomenal work. Thank you, Doug. I will start with some pointed questions and then move to a less scripted component. So bear with me. And again, I want to thank you for being a part of this, and I hope you will enjoy our panelists. So Ginger and Doug, my first question to you is, what has the past 6 months, through COVID, what have they taught you about working during a crisis?
I'll go first. And
yeah,
so
thank you,
Jim. Back in my career to some of the experiences that I've had that I felt like were crises or challenges. And obviously nothing compares to what people are experiencing this year with COVID. And I have just the utmost regard for the frontline workers and can't imagine the concerns they have of potentially taking home the virus to their families as well. So I applaud them so greatly. I reached out to several other colleagues in my former system to kind of ask their perspective. And one of the greatest learnings that all 3 of us agreed that we've had is that communication is key during a crisis situation. And in particular, in the COVID crisis, my former organization, we built a foundation where we didn't make decisions in a silo. So frequent daily conversations to be able to understand what was going on across the organization, whether it was practices or hospitals, was essential. And then with the medical practices, conversations throughout the day with managers to be able to share information and to be very transparent, but also to be able to understand the gaps and the challenges that they were having was just significant. But I think what comes out of that communication that is so key with the transparency is to be able to comfort those that need that leadership. And so I think the ability, you may not always have all the answers, but I think that willingness to be open just helps comfort individuals that oftentimes they're concerned. There's been so many furloughs of healthcare employees across the country, and I'm sure across the world, pay reductions. And when we're at a situation where people are concerned about their health and their family's health and the ability to put food on the table, they need to see that comfort from their leaders. So I walk away as communication being a very strong skill set for a champion. And I think it's one that will really take us through crises much better than if we're not communicating openly.
Thank you, Ginger.
Yes.
Doug, do you want to chime in?
I sure do. I think there's a lot we've learned, again, in the healthcare world. We went in Arizona from the beginnings of the pandemic where we were trying to figure out what was going to happen. We had shortages of PPE. We were facing a lot of challenges. And then the lockdowns occurred, and we went from sort of normally coming off our busy season, which is the wintertime in Arizona, to literally having virtually no elective procedures, no non-emergent procedures, to really having not enough work for people to do. And that lasted for about 4 weeks. And we were really trying to figure out, how do, going back to what Ginger mentioned, how do you make sure you take care of your workforce? People can't just be furloughed and with no consequences. And so we really worked hard to try to figure out how we could manage to flex and do other things to keep everybody engaged. And then we saw the surge start to happen, and it went from being very quiet to being overwhelming very, very quickly. And then you're trying to figure out, we've got more work than we could possibly have done by the people we have available. And you're asking people to go from being furloughed, or in our case, the flexing down to flexing up in a big way to work extra shifts because you can't find travelers and others to come in fast enough to help you. And then we dipped back down and sort of had a period of normalcy. And now we're ramping back up again rather rapidly in Arizona to another surge potential. There's a couple of things I would say in terms of just lessons learned around this. One is the concept of situational leadership. And as a leader, you have to recognize that sometimes the person whose title is in charge is not the one who should be in charge. This is a clinical crisis. Our chief medical officer, Dr. Keith Frey, and our chief nursing officer, Robin Shepard, they both stepped up. And really, when you're trying to figure out what you're going to do, the clinicians really are the ones who have to take the leadership because they know on the ground what we're trying to deal with, and it shifts. And so you have to be responsive to that and not sort of enforce your title, if you will, when there are other people who can better address the immediate issue. The other thing you have to be very, very clear about is what are the goals? What are we trying to accomplish? How are we going to go about doing it? And what is the value set we're going to use? We're very fortunate. We have a very strong mission and set of values. So that is something we can come back to easily. If you don't as an organization, that can be challenging. And then also help people understand how we're going to make decisions. In some cases, things have to go up to a larger group consensus. In other cases, you have to empower people to make decisions on the field. I mean, there are some things when you're in a crisis, they can't wait. We don't have time to bubble it up to the top. We've got to empower people to make a good decision with parameters. And you also have to hopefully help people understand how you're going to make decisions, because sometimes you have to call it from the top. And at that point, you have to be able to just tell people, yes, we considered everything. Here's the answer. Now let's go make it done, make it happen, because we don't have time to revisit it right now. And I think that clarity is really important. That's what we heard from our folks is being clear about the what we're trying to do, how we're going to go about doing it, and recognizing that if we make a mistake, we'll fail fast and we'll regroup and redirect. But having that commitment and the transparency, I think, is critical.
Thank you, Doug. Picking on two of the comments that you both have made, Ginger and Doug, one is clarity and the other one is compassion when it comes to leadership. How is healthcare going to evolve? And so what should healthcare companies do to be best positioned as healthcare evolves? I mean, COVID is a big kind of turning point for many healthcare organizations, but there are, as I was mentioning earlier, there are some wider changes that are taking place. So what's your perspective on that?
I think you're absolutely right. The industry is changing rapidly. I think that's one thing we were looking at prior to COVID. Things were moving very, very quickly. A lot of technological advances, but also structural advances in the way we do things, and having to really take innovation to scale. That's one of the things that's really remarkable about being part of Common Spirit Health, which is the union of ourselves and CHI that we formed about almost 2 years ago now. Is the ability to take ideas and then scale them rapidly and learn where you get something that works in one place and share it somewhere else. But I think that was happening before COVID. And then we went into COVID where we had to do things much more rapidly. I mean, we had a plan for extending telehealth across the organization in a much bigger way than we had. We'd already been doing some of it. Well, in the course of about a week and a half, we went from 0 to 400 miles an hour. We got it done. We had a plan. Now we had to modify that plan and move it, but we had to move much faster than we're typically been accustomed to in healthcare. And I think that's going to become much more the norm. We can't wait and study things for weeks and months and years. We have to move. We have to get some things done. We also have to go back and think about who are we serving? At the end of the day, we have a very unique environment in that we don't have one customer. If you're in some retail businesses, you have a customer trying to target. We have to work in an environment where we have a customer, a patient that has a set of needs, but then we have someone else who's paying the bill. That's the government or an employer or somebody else potentially. We also have physicians and our own caregivers and staff, and they're all in many respects customers, especially as we enter an era which we predict for the next 20 years, shortages, certainly of physicians and nurses and other critical healthcare staff are going to be in a shortage scenario. So you have to make sure you're building an organization that's appealing, that they want to work at, that they get excited about the mission you're trying to accomplish and what you're trying to do. Otherwise, you won't be able to retain them and you won't have a business. I think that's very, very different than we may have seen in the past and somewhat different than we see in other industries today.
Thank you, Doug.
I agree, Doug. And, the point about the conversion of telemedicine, I think that was a great example of actually a positive that's going to come out of what we've experienced this year, where previously CMS and payers really felt like, telemedicine was just for those scarce specialties, but now it's really creating a solution that's much more cost effective and a better use of resources, and patients really like it. So, I'm hopeful that that will continue. I think that's a great example of the fact that our consumers have choices, they can go elsewhere. And so, patients want to have the type of service they want, where they want it, and how they want it. And so I think we'll see continued growth with that, and the organizations that understand that they do need to meet the patient needs are going to be the ones that are going to be successful. In healthcare, even before the financial impact of COVID on healthcare organizations, we were seeing, for the last decade, many mergers and acquisitions. And I think even with I think it's $175 billion that's been funded for the CARES Act for healthcare providers, they operate on a razor thin margin. So I think we're going to continue to see more challenges around the financials of healthcare organizations. With that comes opportunities because, we spend more on healthcare in the US than any other country, but we have great opportunities with digital transformation, and so many healthcare systems are embracing that now. I saw a statistic where 60% of physicians are very receptive to digital transformation as well. So I think, we could look to partners in pharma and hopefully pharmaceutical companies, and, what we'll be able to do in the future around 3D printing and, transforming processes that in the past have been extremely manual in the healthcare world, hopefully are going to lead to better patient care, better outcomes, and also be able to help us bring those costs down, because that's going to continue to be a huge challenge for healthcare systems.
It's really true. I know we saw that particularly in behavioral health. The movement to telehealth had a dramatic impact on the no-show rate. So far fewer appointments being missed, and reduced costs, because in many cases, particularly for the safety net, we would have to provide transportation for those folks to get to their appointments. By doing it in a telehealth environment, not only are we not having to have the transportation, but we're also eliminating that no-show rate, which was often significant, a significant portion, which improves then the efficiency for the providers. And more importantly, those patients are getting the services they need in order to live a healthy, happy life. And it's something that I think we've seen now proven out through COVID, and I think will stick because it's better care.
I did see a statistic that was kind of mind-blowing where Goldman Sachs says you can take $300 billion annually out of cost from digital transformation when it comes to remote monitoring and preventive care. So, the device alerts the physician, and then when the patient actually does need to be seen. And so, those are huge dollars that we've never been able to figure out how to cut a supply cost to yield a savings like that. So it's exciting. I think it, lends to, we'll be doing things a lot differently in the future, but I think it lends to some very exciting changes in the future too.
I think it definitely does. And it's both an exciting, but also a little bit of a scary time, because it means we've got to make substantial changes, and we have to resolve issues. When you start thinking about having home monitoring, there's a whole set of privacy and other issues and data security issues that we got to make sure we get right, because it's people's health and their privacy that's at stake. And so as an industry, we have to figure those things out, because the promise is there, but it's not a straightforward path as it might be in some other industries.
All what you're saying makes me think of how sports as a discipline has changed over the past 30 years, in part through technology, but also through the kind of the increased challenge that athletes are now tasked with accomplishing as they get better and better. So in that sense, there's almost here an interesting parallel. It almost feels like an obstacle course. So you better be prepared to manage the obstacles and have the right equipment to get going. So pardon the pun there, but it feels really appropriate here. So I want to drill a little bit into this champion mindset. Given that we have two specialists, both with healthcare and sports background. Debbie, I'm going to ask you, if you don't mind, if we can drill a little bit deeper on the skills that are needed, given the context that Ginger and Doug have provided. Can you share your perspective on what you think are the essential skills that leaders need in healthcare today for tomorrow as well?
Yeah, and from our research at Eller and then our ongoing work with healthcare leaders, and I love it when people give me a great transition. So thank you, Ginger and Doug, because one of the keys that we have found that are really critical for leaders, I'm going to tie a bow around some of your comments, is around agility. And that's really what you said, that along with this uncertainty, volatility, shifting conditions, that leaders need to really be more than ever agile. And it's also about making sense, we call it sense making, of all this data that's going around there. And as you said, Doug, you don't have a lot of time. You've got to move quickly. You've got to begin to be more anticipatory, and you've got to make decisions and go. And so agility is one of those that we found is I'm going to talk about a few, but in no particular order, but agility is one. And then secondly, and we just finished a piece of research where we were asking leaders all around the world to look at what was most critical now versus in the past. And it probably, again, with your comments, wouldn't surprise you that the number one is around inspire and mobilize. And this has always been really critical for leaders, but as you both said, even more so now. And it's not only about putting that agility to action, but then it's around quickly being able to mobilize and align people. And it's around quickly doing that on an ongoing basis. And as you both said, it's the clarity of direction, but also it's reminding people about the purpose. Why are we doing this? Why do we need to do this now? How is it linking back to our values? And as Ginger said, also, it's around that balance of, we still need to focus on the results. We still need to, we're running a business, and we also need to focus on the people and the compassion. And Doug, you mentioned Dr. Frey, who I hope he's on. I had the opportunity to work with him on another initiative, and I've been really been so kind of amazed, but in a positive way with his posts on LinkedIn during this time, because he's really, with his posts, has been inspiring people and really appealing to that compassionate side and really showing that both are important. And
he's a remarkable leader.
yeah, and truly, I read his posts and I get inspired myself. And then last but not least, which is probably the topic of this, which is winning mindset, and is overarching, is the mindset that leaders are going into, and approaching this and how they choose to show up. Because we know that mindset really drives behaviors and actions. And part of our work around leadership is around helping leaders develop what we call a growth mindset. And that's around ongoing learning. And as again, you both said, looking at, boy, we see more people are really embracing telemedicine. Let's jump on that. So they're looking at potential adversity and saying not what an obstacle this is, but how can we create an opportunity around that? And the other thing that we know about growth mindset is in these times of difficulty, that growth mindset leaders, they're able to confront, they're not Pollyannas, let me put it that way. They're able to both confront the reality of the situation. They don't shy away from it, but they are also able to offer hope and optimism. And it's really both of those. So to really summarize and again, tie a bow around the comments: agility, inspire and mobilize, and a growth mindset. And I know John will talk about mindset too, because I had the opportunity to interview him as part of the resilience piece. So I hope Joe will take an advantage of that.
Yeah, absolutely. Thank you. Thank you, Debbie. John, I would love to move on to you. Healthcare leaders can borrow a lot from your experience as both an elite athlete as well as a trainer of elite athletes. What would you say are the things that they can borrow from your own experience, which have become part of our program? We thought that it would be so important to add them.
There's so much out there. I think, whenever I speak to people about these types of subjects, the one thing that I'm always careful to make everybody realize is that sports has got a very unique advantage as far as growth and development of systems and processes and learning, because we live a full business cycle every single year essentially, and we're able to adapt and adjust and tweak and work together to make sure that whatever we're doing, we're going to be better the next time. Whereas most real world situations are never ending, always going, and you don't really come to those endpoints of true analysis and restart that we get to do. So when I retired as an athlete and went into the real world, as an athlete, we actually did indoors and outdoors. So I had about two essentially seasons a year that we would restart. And I started the company and I had it for 10 years and I never got to that end point the whole time. But we were always trying to adapt and move. And so I think that I'm lucky that I have the perspective on the business side to know what the real world's like after having done the athlete thing for so long. But I'd say everybody sees the team in that business that I built. Nobody really sees how deeply entrenched the team concept was for me as an athlete, because I was out there by myself, but nobody noticed the physiologists and the biomechanists and my coach, of course, and nutritionists, and this team of people that to a degree was managed by my coach at the time, but was also, as I got older, co-managed by me. And then I had to manage my coach as well. And I think that when you're going through, we had the blessing and the curse of having very stressful situations all the time. And to a large degree, I don't think, it's hard to find a situation that is that stressful outside of military, I think, and military service. And what became very clear, and it still is clear, is that, and this is what I know we're seeing in healthcare right now, is that errors happen, mistakes happen, people screw up because we're all human. And I know we were talking earlier about clarity and communication early on with what was being done to manage the situation. I think I would like to add in credibility for another C, just because we need more C's, I guess. To me, in these situations, in sports and in what's going on in healthcare right now, credibility is everything. And the team, everybody on the team has to believe in the leaders, and they can smell somebody who's insincere and or not credible. If they have that innate ability, then the biggest problem is that they will not have the trust. And you have to have a genuine person who can instill the trust. Now, from the leader's perspective, you have to have 100% accountability, which is another place where leaders often fall down. But if you can train yourself or other leaders that work under you into complete accountability, where everything in their mind is their fault if it goes wrong, and everything in their mind is their team's fault if it goes right. And they have to be able to sincerely convey that to the team, and then nothing will ever fall apart. Mistakes, like I said, mistakes happen, and it's inevitable that something's not going to get done right. Something in hindsight is going to look like a train wreck. But if the team doesn't fall apart, eventually everything gets solved. So.
Great. Thank you, John. That was really very interesting. I'm going to open the question, my next question, to the group. And so I'll let you decide who wants to answer this. Many of us are going from crisis to crisis. I feel that I'm speaking for the whole world right now, given that we're pretty much all in the same boat. And yet we all have to build resilience, new skills, and advance our careers. Ultimately, we need to stay the course. What would you recommend to our listeners, the people who are in our live cast today?
I'll jump in, Joe, with that one, if that's okay.
Yeah.
Let's go back to what Debbie was talking about the continuous learning. And so in my career, it was a very demanding role, 1,000 providers and, very large staff of support as well. But by continuous learning, whether it was through an education program or very involved in associations that fit my field, both on a regional as well as a national level, that gave great opportunities to know what was coming down the pipeline and to have colleagues to be able to bounce things, ideas off of. And oftentimes those associations are involved in policy setting as well. So very helpful to be involved in those types of groups. But then also just having the opportunity to network with colleagues really helped me grow and become more confident in my role. And then that led to me having greater resilience. When you feel confident in your role, then you can go and support your team and accept that accountability and hopefully be able to inspire them. You may not have all of the answers, and the best leaders we can be are when we know when we need to rely on others, experts and other departments, and and our staff for ideas. But I think for me personally, that's how I really balanced my resilience, was that confidence in my job let me grow in my career as well. And it helped me balance so that I knew that I did have to support my own self-care and would do that through time with family and friends and exercise. But by having that continuous education, it gave me the confidence that really helped support my personal resilience.
Thank you, Ginger.
That's really well said. One of the things I would add is just, you really have to make sure you're doing work you love, because at the end of the day, you're going to spend so much of your life doing it. If it is not what you love doing and you don't have that passion and really believe in the value of what you're trying to do, it's really hard to be resilient, because as you hit these very difficult times and you have to push through, because even if you love your job, and I really love my job and I love the people I work with, and I really believe it's meaningful, I still have those occasional days where by the end of it, I'm glad that day's done because I'm done. So that's really important. I think the other, and that's part of what we're talking about today is, if you're not in that situation, you take the opportunity to get education, to do some things to change it and get into a place where you've got that passion. The other thing is, as Ginger said, don't forget yourself and your family. Your family and your support structure and your friends are important, because it's part of what helps keep you sane and keeps you in a position to do and give all to your job and your passion. And also yourself. So recognize the signs of when you need to just go read a book, or when you just need to go take a walk, and let some of that stuff go for a little while, and recognize that, hopefully you have a great team around you. And when you need to take a walk, somebody else can step in, and, vice versa. You can know when somebody else needs to take a walk, and you can step in and let them have that time. And I think that's one of the things that makes a great team, is when you can do that for each other.
Thank you, Doug.
Yeah, and I'd just like to add one last thing around mindset, that a colleague told me that mindset is a choice, and we really have a choice how we show up every day. And if we find that we're starting to kind of spiral down and either starting to continue to blame others or always blaming ourselves, and as one of John's colleagues says, we continue to wallow in it, is to really look at, is that how I want to show up? And to also growth-minded leaders that we found, they're able to separate out those things that they can't control and really focus on those things where they can control. And to Doug's point, to really look at what are those things that I can control where I can make a difference.
Thank you, Debbie. John, I'm going to ask you, if you don't mind, to chime in as well, because I can't even imagine as an athlete what it feels like to have to rebuild yourself after losing an important race, or getting into a physical space where you're not feeling your best. So I feel that you have a really unique perspective here that you can add.
Yeah, the thing, again, we go back to the concept that we had seasons, right? And 9 out of 10 of the seasons do not end the way you want them to. And you have to learn how to bounce back and be resilient after that. And the first thing that I always did is I tried to simplify as quickly as possible so that I can assess what really happened and what I can do about it. And to do that, I would remove as much external stimulus as possible, really do a hardcore evaluation. And we go back to that accountability conversation we talked about on leadership. Accountability doesn't just go to the people that you work with. It's not that you are just accountable to them, you're also accountable to yourself. And you need to be able to look in the mirror, and you need to be able to tell yourself the hard truth and where the screw ups were. Because if you don't recognize it, then you don't find the solution, because you're too afraid to confront it, and you're just going to work your way around it. So one of the hardest things in the world, and it's something that sounds very simple, but it's against all human nature, is that in order to feel better, you have to make yourself feel worse in the first place. To get to good, you have to go through the bad. And that's how you get better at what you're doing. And the hard reality is most people don't want to go through the bad. And I tell people all the time that it's the best thing in the world, because you'll feel so much better by facing up to everything that is causing problems. And I think this is a good time to also cover a little bit on the burnout side of stuff too, because regardless of how you're managing your failures or this or that, or shortcomings, there's also a burnout issue that's very real in healthcare right now, with the load that everybody's shouldering at this point. Athletes have the same burnout problem too, because, not to go too deeply into it, but in the transition into doping control and people actually having to not use drugs, recovery became an issue, and all of a sudden overtraining became an issue, and all of a sudden you've got burnout problems. And burnout comes from two different sources. It's either going to be a physical problem, that your body's actually that tired and everything's just shutting down. You can actually do some central nervous system testing to determine if that is the case. And secondarily, you have mental burnout, which is a product of one of two things usually. One is that you have too broad of a palette of stimuli and your brain can't handle it all because you're going to have to do all these different things. Or number two, you having to monotonously do the same thing over and over and over, and you don't get a break from that. And somewhere in the middle is where your mental fatigue faculties can be kind of maintained. On the physical side of stuff, I think, Ginger talked about exercise and how important that is. I think two things that I got to add to that is the rest side of stuff and nutrition. And proper eating is critical because you have to fuel just like any other athlete would have to fuel. And rest is the one that's probably the touchiest, especially under the load that everybody in healthcare is doing right now. But rest is critical to that. And sometimes it's that hard decision of do I go to bed or do I watch some TV with the kids? And sometimes in life, self-prioritizing is the key to success and down the road. And nothing's permanent. This is the time when being a professional athlete as a healthcare provider is probably the most appropriate it's ever been. Where you have to, because the whole world depends on you guys. Everybody's counting on you. So I don't think anybody's going to get upset if some time for self-care on the physical side of stuff is done. So.
Thank you, John. That was really great. I'm going to, I could keep going asking questions, but then they would be my questions. And it's really the space for those in the audience to ask. So do we have any questions from the audience that we want to pull from? Nick?
Yeah, we've got 5 actually, 6 now. Some of them are actually targeted. So I'll just, if you don't mind, Joe, just ask directly to the panel.
Yeah,
so
go for it.
Yeah, Doug, this is to you. So you spoke about being sensible about goal setting. With the rapid changes, sometimes by the hour, how far in advance should we be planning right now?
Well, that's a very, very good question. I mean, you still have to keep an eye on the long range plan. So we are still doing, and we're kicking off now our 5-year forecast for 5-year plans, because if you just stay in the day-to-day, then those long-term things that take a long time to have happen. As an example, we're working with Creighton to develop our 4-year medical school. We're also doing work with the University of Arizona as well around a lot of different programs. Those don't happen overnight. They take 5 years, 10 years to evolve. We're doing a lot of other thinking about development of facilities. So you're trying to build a tower, or you need to build an expansion. Those take a couple of years to plan, and they take 10 years to develop. So you have to keep a focus on the long range, but at the same token, you have to be very quick about redeploying, reevaluating when you're going to do different things, because the world's changing, and you've got something that's an immediate challenge. You've got something that immediately you have to do. So, in some cases we had to postpone buildings that we had underway because we really needed to refocus on the COVID response immediately. That has implications, but you have to trade those things off. But if you don't have that long plan, then you're going to get through this crisis, and you're not going to have the things in place that you need to be responding to your patients, your other stakeholders in the long run.
That was great. Thank you, Doug. And John, this one is to you. So John, you spoke about restarts in order to reevaluate the situation. I think it would be very helpful for my team to take a break, step back from the situation and reevaluate. Any ideas how to approach a forced restart? Sorry, these questions keep coming in. There we go. Any ideas on how to approach a forced restart in an environment where breaks don't happen naturally because we're going from crisis to crisis?
That's a tough one, because when you're in the weeds, that's usually you want to do an evaluation and kind of break check everything after you've completed that task. And when you're in the middle of the task, it's very hard to adapt on the fly. There is a method that you can use, which, when you're halfway through a season and stuff's not right, you can do essentially a shared leadership role break, where if you have a team of 6 or 8 or 10 people under you, and you essentially do a 2-person break off on a leadership role, and you have them do an evaluation of what they're seeing is going on with the team themselves and the other people. And then they get back into the weeds, and you roll the next 2 people through. And then after you've gotten through the 4 groups of 2 people, now you've gotten 8 different perspectives and shared leadership on exactly what's going right and what's going wrong. And then you can sit down in one quick meeting with them and decide as the leader, these are the things that you guys said that are valuable, and these are the things that we need to do and fix and change. That's about the only way to roll through it in the middle of it, is you have to rotate that responsibility of leadership to them. And that's the other thing too, is that, everybody on a team is a leader in amongst themselves, even if they're only leading themselves. And to share that leadership is also a morale boost as well, because they're going to feel like they're important, and what they have to say is something of consequence to the person who's in charge. So they're going to buy into whatever's going on much more strongly than if they're just being dictated to and told what to do. So there's a very strong value in that shared leadership.
You were saying communicating the why is so important, because even if you have to make the decision as sort of a given, if people understand the why and it was made in the values of the organization, then they're much more likely to buy into it and move forward than if it's just a random dictate that they don't understand.
And again, if you have their trust because you've built a relationship with them over time, it's very easy to send those messages.
Thank you. That was great. And I believe, Debbie, this one seemed to pop up when you were speaking. And John, you may have a thought here, but are there any mindset tips you can give to frontline staff who are close to being burnt out? How do you keep a positive spirit, or how do I keep a positive spirit in my team?
Well, yeah, that's a tough one, and I'll start and ask John to chime in. One of the things, and I talked a little bit about it, but it's underrated, and Doug alluded to it, is really going back to the purpose. And purpose, and a sense of purpose, is the #1 kind of component of resilience. And so and that can really help with the mindset. So potentially reconnecting yourself or your team with what is it that we're really trying to do here. And usually purpose is the higher purpose in service to others, and the why can help people get grounded again, and can help, at least for a small piece, mitigate against burnout. Just one other piece that's also underrated is the power of connection. And so often we think that, oh, we're so busy, and that if we take time to be with somebody else, that'll take time away from either our patients or what we're focusing on. And it's actually the exact opposite. So connecting with others, reaching out to others, and I don't think he'll mind me saying this, but Joe is a good colleague. And whenever I'm a little down, I'll just send him a text, and he'll know, and he'll call me immediately. And that just connecting just brightens up my day, and I feel better. And so those are 2 things. I know John has others as well, but that can really help with the mindset. But if you're grappling right now, I would urge you go back to your purpose and really understand what anchors you. At the end of the day, what's going to keep you grounded, and continue to go back and reflect on that. And the more that you have that, the more that's going to help get you through.
That's absolutely true. I think helping to also celebrate the successes is really important. One thing we found, I was just talking with one of our CEOs yesterday, and one of the things that they've done in one of the staff entrances is just put up a big board of the COVID successes that we've had. Because if you're a nurse going onto a COVID unit where perhaps it's just been a bad day and you've lost a number of patients and it's just been really difficult, you can forget that there are a lot of people we saved, and a lot of people whose lives are changed by what we've been doing. And to just remind people of that good that's coming out, or whatever success it may be that you're doing, and just bring that to the center and remind people. So again, it does tie back to your mission and your values of why you're there, but it also reminds people that, while we may have had a tough day today, we've made a big difference in the last week. And it really, I think, helps.
And that difference ties to the individual feeling of purpose, and that what at the end of the day, people want to know where what they did have meaning. That's such a great point, Doug. And pointing back to here's what we were actually able to do, and that reframes the mindset from here's what we weren't able to do to here's what we were able to do.
Mhm.
Thank you. This is great. I've got a good one here. This is pretty much to the group, it looks like. I'm a physician, a lead physician and lead physician wellness at my hospital, which, as you all have noted, is essential right now during COVID. Physicians are stoic and have a trouble being vulnerable. How would you encourage vulnerability and authenticity among physicians to build resiliency?
I would go the opposite. I wouldn't try and get them to be out of character and be vulnerable. I would actually challenge them to do self-care and self-maintenance and make it a challenge and challenge them to prove that they can do it versus trying to get them to admit a weakness. First thing I would do with anybody that's in that alpha position that feels like it's out of their nature to ask for help or be vulnerable is those are the kinds of people you can get hard with, and you can set standards and challenge them to pursue those standards and succeed in ways that you can't with a lot of people. So it's just a matter of who is the person and why are they resisting that self-maintenance and self-care, and kind of knowing exactly how to approach them is critical.
This whole subject of physician and caregiving resilience, it could be a whole session in and of itself, at least. Dr. Keith Freyer, we talked about a few minutes ago, is leading that for Common Spirit across our entire organization, because we've recognized what an important aspect it is to not just the care day to day, but also the future of our organization, being able to have physicians that are able to really be focused and be in a position where they don't burn out. And it's a huge challenge. I know he's spent a huge amount of time and actually done some great work with the university as well around some of those things. And I think it's very important, but hard to do justice in a very short answer to a question.
And I think that critical for the future too is, this too will pass. And when it's done, then the critical thing is to use it for a tool in the future to get people to understand why learning to maintain themselves and prepare for just another event like this is important, so that people, you got to be in shape. You literally have to be in mental shape to handle big problems, and you have to be in mental shape to have the discipline to get through it. And a lot of people, not just in medicine, but generally in the world, are not in mental shape to make it through crises. And to be able to strengthen that in the times of plenty and the times of good to prepare for it is critical. And that's going to be a post-COVID transition. And that's going to be one of those things where, just like a season, where you reevaluate after the season, what could you have done better to get ready for this? Now everybody knows, okay, this can happen. Now, how do we get everybody equipped so that when it does happen again, the system's strong?
Mm-hmm.
I also might add there as well, within our group, the larger that you get, the less opportunity you have for the physicians to know each other and to oftentimes know people outside of their own, venue, their unit, or their practice. And so maybe having a mentor position, whether it's the physician leader or maybe it's somebody even totally outside of their group, especially with new physicians, I think that's important. We also, the larger that we became, when people didn't know each other, we started doing some social events quarterly. And obviously this is not during COVID times, but where they would bring their families, because, physicians, they have such demanding careers, and, any available time needed to go towards families. So when we could plan some social events and they brought their families, they were proud of their job. We got a chance to meet their families, and I can tell you the positiveness that came out of those types of events was so much better than doing a large holiday celebration of, with spouses or significant others. So being able to, even though you're very large, have that relationship and to be able to be like a family, whether it's the work family or the home family, and have the chance to mingle those really helped with our relationships as well.
That is great. And I know we've got maybe 3-4 minutes. So I want to pause here and Joe, hand it back to you to send any last words or offer any last words to the panel.
Well, I want to thank the panel for their contribution today. I have learned a lot myself, and I feel that those in our audience will surely take some takeaways. We had a lot of questions. And so I feel that one of the things that we can do is to offer to engage offline if you want to have the answer to those questions with us, either with our team at Dignity Health Global Education or with us at University of Arizona, where we want to make sure that you get as much value out of this session as you possibly can. But some of the themes in the session is what we are building in what we have built in our Mini-MBA program. And I want to give Andrew, I want to thank the panel, but then I want to give Andrew to do some final words to wrap up this session.
Thank you, Joe, and thank you everyone here. It's been fascinating to share your knowledge with everyone. And it's fantastic that your experiences are being shared with students as part of the program we've developed with our partners at University of Arizona. That program itself will start in the last week of January, and we welcome students from across the US and internationally to join this program. It's a fascinating program mixed with healthcare practitioners, world-class academia, and genuine world champions, Super Bowl winners, unique perspectives. So we think this program can really help healthcare workers, whether they be in administration already or clinicians transitioning into management. There are any number of roles that this program is made for. So we welcome more students to ask us any questions about it and inquire. This is our first DHGE Talks. There is another one coming up, which is December 3rd. As part of that, we have a few heavy hitters on that board as well. We have Marvin O'Quinn, who's the president of Common Spirit, the largest not-for-profit healthcare system in the US, and also where our colleague Doug Watson is based as well. We've also got Chris Lowney, who is a well-known speaker in healthcare, but also the deputy chair of the board of Common Spirit. And again, like today, just to mix it up and add a slightly different angle, we've also got Geeta Nayar, who is the executive director of healthcare at Salesforce, which is obviously one of the largest tech companies in the world. And she adds unique sort of private insight from the tech space around staffing and the workforce alongside Marvin and Chris. But for everyone here today, thank you so much for joining us. It's wonderful to see you all. And for everyone who's watched this webinar or live cast, as other people call it, thank you for making time.